Morphine is one of the most well-known and powerful medications in modern medicine, widely used to manage severe pain. Whether in hospitals, emergency rooms, or in the treatment of chronic conditions like cancer, morphine has provided relief to countless individuals suffering from intense pain. It has a rich history, having been used for centuries to alleviate suffering, and remains a cornerstone of pain management today. However, morphine is not without its complexities. While it is effective in relieving severe pain, its use comes with significant risks, including potential addiction, side effects, and the dangers associated with long-term use. This dual nature of morphine, as both a life-saving medication and a substance with considerable potential for misuse, makes it essential for both patients and healthcare providers to understand how it works, how it affects the body, and what the potential drawbacks are. In this discussion, we will explore what morphine is, how it interacts with the human body, and the risks that come with its use. By understanding these aspects, we can better navigate the delicate balance between using morphine effectively and ensuring its safe, responsible use. Whether you're a patient, a healthcare professional, or simply someone curious about the drug, this guide will provide valuable insights into the complexities of morphine as a medical treatment. Morphine is one of the most powerful and well-known opioid medications in the world. It has been used for centuries to alleviate severe pain, making it one of the oldest pain relievers in medical history. Derived from the opium poppy, Papaver somniferum, morphine has had a significant impact on medicine, particularly in the fields of pain management, palliative care, and emergency medicine. The drug was first isolated in 1804 by a German chemist named Friedrich Serturner, who named it after Morpheus, the Greek god of dreams, because of its sedative and calming effects. Chemically, morphine belongs to a class of compounds called alkaloids. Alkaloids are naturally occurring organic compounds that have various effects on the human body. Morphine is one of the most important alkaloids derived from the opium poppy, with other well-known alkaloids including codeine and heroin, the latter being an illegal and highly addictive form of opioid. In medicine, morphine is primarily used to treat severe pain that cannot be managed effectively with non-opioid analgesics, such as over-the-counter painkillers. This includes pain from major surgeries, trauma, or advanced stages of diseases like cancer. It is available in various forms: oral tablets, liquid solutions, and injectable forms. The method of administration significantly impacts the drug's onset and duration of action. For example, intravenous morphine acts quickly, providing rapid relief for acute pain, while oral morphine may take longer to work, but can be more convenient for managing chronic pain. Despite its effectiveness in treating pain, morphine's use is surrounded by significant medical concerns, primarily due to its addictive potential and side effects. To fully understand why morphine is both a life-saving drug and a source of concern, it's important to examine how it interacts with the body and why its misuse is so dangerous. Once morphine is administered, whether orally, through an injection, or intravenously, it enters the bloodstream and travels to the brain and spinal cord, where it produces its pain-relieving effects. The human body contains a system known as the opioid receptor system, which is responsible for processing pain signals and regulating various bodily functions like mood, pleasure, and respiration. Opioid receptors are located throughout the brain, spinal cord, and even in peripheral tissues. There are three primary types of opioid receptors: mu, delta, and kappa receptors. These receptors are activated by various substances, including endogenous opioids like endorphins, which are naturally produced by the body to reduce pain and create feelings of well-being. Morphine, as an external opioid, mimics the action of endorphins by binding to these receptors. It specifically binds most strongly to the mu-opioid receptor, which is the primary receptor involved in producing analgesia, pain relief, and euphoria. The mu receptor is located in areas of the brain that regulate pain perception, such as the thalamus and brainstem, as well as areas related to emotional responses like the limbic system. When morphine binds to these receptors, it blocks pain signals from reaching the brain and produces a state of pain relief. At the same time, morphine stimulates the release of dopamine, a neurotransmitter associated with pleasure and reward. This release of dopamine is one reason why morphine can make individuals feel euphoric, leading to its potential for misuse and addiction. However, the activation of opioid receptors doesn't only block pain signals, it also impacts various other body systems. Morphine can cause changes in mood, impair cognitive function, and affect gastrointestinal motility, among other effects. These changes explain why morphine can have both therapeutic and harmful side effects, especially when taken over a long period or in large doses. The interaction between morphine and the brain's reward system is critical to understanding why the drug can be so addictive. Dopamine, which is released during the use of morphine, is a neurotransmitter that plays a central role in the brain's reward system. When dopamine is released in response to stimuli, whether pleasurable or rewarding, it reinforces behaviors that lead to its release. This system is vital for survival, as it motivates individuals to engage in behaviors that are necessary for well-being, such as eating or engaging in social bonding. Morphine works by stimulating the release of large amounts of dopamine, leading to feelings of euphoria, well-being, and intense pleasure. This is particularly evident in individuals who misuse morphine or other opioids for the purpose of experiencing these pleasurable effects. The euphoria produced by morphine can make people feel relaxed, content, or even ecstatic, contributing to its potential for misuse. However, as with other substances that trigger the release of dopamine, repeated use of morphine leads to the brain becoming accustomed to its effects. Over time, the brain adjusts to the continuous presence of the drug, and the individual requires higher doses to achieve the same euphoric or pain-relieving effects. This is known as tolerance. Tolerance is a key component of substance dependence, as the individual becomes less responsive to the drug's effects, and increasingly higher doses are needed to achieve relief or pleasure. This process of developing tolerance is part of the cycle that can lead to opioid addiction. As morphine use continues, the brain's reward system becomes reliant on the drug, leading to cravings and intense desires to obtain more of it. At this stage, the person may continue using morphine not only to relieve pain, but to avoid the negative feelings and withdrawal symptoms that occur when the drug is not available. Although morphine is highly effective in treating pain, it is not without a wide range of side effects. Some of the most common side effects of morphine include dizziness, drowsiness, nausea, vomiting, and constipation. These effects occur as a result of morphine's widespread influence on the central nervous system. Morphine's impact on the gastrointestinal system is one of the most commonly reported and problematic side effects. By binding to opioid receptors in the gut, Morphine slows the movement of food and waste through the digestive tract. This delay in digestion can lead to constipation, which can be severe in individuals who require long-term opioid therapy. Chronic constipation may necessitate the use of additional medications or lifestyle changes to manage, and it can cause significant discomfort. In addition to gastrointestinal issues, morphine can also impair cognition and motor function. Drowsiness and confusion are common, particularly when the drug is first introduced or when the dosage is increased. Because morphine can alter cognitive processes, it is dangerous for individuals to drive or operate heavy machinery while taking the drug. The sedative effects can also increase the risk of falls or accidents, particularly among elderly individuals or those with other health complications. Furthermore, morphine can affect the cardiovascular system. It can cause low blood pressure, hypotension, and slow heart rate, which may not be well tolerated by some individuals, especially those with pre-existing heart conditions. While these side effects are often manageable in the short term, long-term or high-dose use increases the risk of more serious cardiovascular complications. Perhaps the most dangerous side effect of morphine is its potential to depress the respiratory system. Respiratory depression occurs when morphine interferes with the brain's ability to regulate breathing by binding to opioid receptors in the brainstem, which is responsible for automatic functions like breathing and heart rate. Morphine can slow the rate of breathing. This becomes particularly problematic when high doses of morphine are administered, as it can lead to dangerously slow and shallow breathing. Respiratory depression is one of the leading causes of death in opioid overdoses, including those involving morphine. In cases of overdose, morphine-induced respiratory depression can result in hypoxia, low oxygen levels in the blood, hypercapnia, high carbon dioxide levels, and eventually respiratory arrest, where breathing stops completely. Because respiratory depression can occur even with therapeutic doses, patients taking morphine are often closely monitored, particularly in hospital settings or after surgery. In instances of morphine overdose, emergency treatment often involves the administration of naloxone, a medication that reverses the effects of opioid toxicity, including respiratory depression. Naloxone can restore normal breathing in individuals who have overdosed on morphine or other opioids, but it must be administered quickly to be effective. The misuse and potential for addiction to morphine is one of the most significant challenges associated with its use. Addiction occurs when an individual becomes compulsively drawn to a substance, despite the negative consequences it causes in their life. As discussed earlier, morphine's ability to release large amounts of dopamine makes it particularly susceptible to misuse. While morphine is an essential medication for managing severe pain, it has the potential for abuse, especially when used outside of medical supervision. People may begin taking morphine for legitimate medical reasons, but over time, the pleasurable effects it produces can lead to misuse. Once tolerance and dependence develop, individuals may take larger doses or use morphine more frequently than prescribed in order to maintain the same effects. This behavior is a hallmark of addiction. Addiction to morphine often leads to negative consequences, such as impaired relationships, financial difficulties, legal problems, and poor mental and physical health. Furthermore, individuals with a history of substance use disorders or mental health conditions are at an increased risk of developing an addiction to morphine. Treatment for opioid addiction typically requires a combination of medical and psychological interventions, including detoxification, medication-assisted treatment, MAT, and therapy. Tolerance to morphine develops over time with continued use. Tolerance refers to the phenomenon in which the body becomes less responsive to a drug's effects, meaning that higher doses are needed to achieve the same level of pain relief, or euphoria. As tolerance builds, individuals may increase the dose or frequency of morphine use, which significantly raises the risk of adverse effects, including overdose and respiratory depression. The development of tolerance is particularly problematic because it leads to a cycle of increasing dependence on the drug. For patients who have been prescribed morphine for long-term pain management, this escalating need for higher doses can create a difficult situation. The higher the dose, the greater the risk of harmful side effects, such as respiratory depression, cardiovascular complications, and severe constipation. Tolerance is one of the main reasons why doctors must be cautious when prescribing morphine for chronic pain. In many cases, healthcare providers will monitor patients regularly to assess the effectiveness of the drug and whether dose adjustments are necessary. If tolerance becomes too problematic, a doctor may opt to reduce the morphine dose gradually or switch the patient to alternative pain management options. For individuals who have become physically dependent on morphine, discontinuing the drug can lead to withdrawal symptoms. Withdrawal symptoms are the body's reaction to the sudden absence of a drug it has become accustomed to. In the case of morphine, these symptoms can be both physical and psychological. Common withdrawal symptoms include anxiety, muscle pain, irritability, nausea, vomiting, sweating, and chills. These symptoms can vary in severity depending on the duration of morphine use and the amount used. In some cases, withdrawal can be intense and debilitating, which is why medical professionals often recommend a gradual tapering of the dose to avoid severe withdrawal reactions. In addition to physical symptoms, morphine withdrawal can lead to strong psychological cravings and emotional distress. This makes it difficult for individuals to discontinue use without proper support. Medication-assisted treatment, MAT, using drugs like methadone or buprenorphine can help ease withdrawal symptoms and reduce cravings, which are essential components of treating opioid dependence. The misuse of opioids, including morphine, has become a significant global health crisis. In the United States, the opioid epidemic has led to a staggering number of overdose deaths, with morphine and other prescription opioids being major contributors to this crisis. According to the Centers for Disease Control and Prevention, CDC, opioid-related deaths have been rising in recent years, with more than 70,000 people dying from opioid overdoses annually. This epidemic is not limited to the United States, however. The World Health Organization, WHO, estimates that around 35 million people worldwide suffer from substance use disorders related to opioids. In response to the growing crisis, many countries have implemented stricter prescription guidelines, public health campaigns to raise awareness about the risks of opioids, and increased access to addiction treatment services. Efforts to combat the opioid crisis also include exploring alternative pain management options. This includes non-opioid pain relievers, physical therapy, and cognitive behavioral therapy, CBT, to help patients manage chronic pain without relying on opioids. The ultimate goal is to reduce the dependency on morphine and other opioids while still providing effective pain relief for those who truly need it. In conclusion, morphine remains one of the most effective medications for managing severe pain, particularly in acute or terminal situations. Its ability to block pain signals and induce a sense of euphoria makes it invaluable in medical settings. However, morphine also carries significant risks, particularly related to addiction, respiratory depression, and side effects that can impair quality of life. To minimize these risks, morphine should only be used under strict medical supervision. Healthcare providers must carefully assess a patient's medical history, pain levels, and potential for addiction before prescribing morphine. Patients, too, must be informed about the risks and encouraged to follow their doctor's instructions carefully. By balancing the benefits and risks, morphine can continue to be a crucial tool in pain management, helping to alleviate suffering while minimizing the potential for harm. With proper monitoring and caution, it is possible to manage pain effectively while avoiding the negative consequences associated with opioid use. In conclusion, morphine plays an undeniably important role in modern medicine, providing essential relief for those experiencing severe pain. While its benefits in pain management are significant, it is equally important to recognize the potential risks, such as addiction, side effects, and the possibility of misuse. By understanding how morphine works in the body, its effects on the brain, and the consequences of long-term or improper use, we can make informed decisions about its place in healthcare. Whether you're a patient, caregiver, or simply someone interested in learning more, knowledge is crucial in ensuring morphine is used safely and effectively. If you or someone you know is prescribed morphine, it is essential to follow medical guidance closely. Stay aware of potential side effects, and seek support if concerns about dependency arise. With the right precautions, morphine can remain an important tool in pain management while minimizing its risks. Thank you for joining us in exploring the complexities of morphine. If you found this information helpful, feel free to share and subscribe for more educational content. Take care and stay informed.